quickly look at the concept of autosomal dominant disorders. Now, previously we spoke about what autosomal recessive disorders. Now, just an overview. Autosomal dominant disorder simply means what? A child could be affected, even if it is just one of the parents that is a carrier. Okay? So that means what? The parent was actually affected. Alright? Autosomal recessive is more of like two of the parents must have the problem and they are actually unaffected. Okay? So when it comes together, one of the child becomes affected. But in autosomal dominant inheritance, one of the parents is unaffected, all right, living their life normal, all right, and one of the parents is affected. Okay, so one of the parents will pass the mutation to the child, right? So that's just what the concept is. So in this, we'll be having an overview, introduction, definition, and look at the examples, all right? So that will just make it a little bit more comprehensive. We said that autosomal dominant disorders are manifested in the heterozygote state. So it is not homozygote, all right? Just heterozygote. One parent can be able to pass it to the offspring, okay? So at least one parent of an index case is usually affected. Both males and females are affected and both can transmit the condition. So now when an affected person marries an unaffected person, every child has one chance in having the disease, okay? Autosomal dominant conditions are characterized by the following. With every autosomal dominant disorder, some proportion of patients do not have affected parents. Okay, so now such patients owe their disorders to a new mutation involving either the egg or sperm from which they were derived. Okay, so it could be that there was a disorder right there at the egg or sperm, and this didn't affect the parents, but it affected the offsprings. So now their siblings are neither affected nor at increased risk of developing the disease. The proportion of patients who develop the disease as a result of new mutation is related to the effect of the disease on the reproductive capability, right? So now if a disease markedly reduces reproductive fitness, most cases would be expected to result from new mutations. Many new mutations seem to occur in germ cells of relatively what? Older fathers. So older men are more prone to all these mutations in their sperm and all that, right? So clinical features may be modified by variations in penetrance and expressivity. Incomplete penetrance occurs when individuals inherit the mutant gene but are phenotypically normal, okay? And this is expressed in mathematical terms. Thus, 50% penetrance indicate that 50% of those who carry what the gene express the traits. Okay. In contrast to penetrance, if a trait is seen in all individuals carrying the mutant gene, it is expressed differently among the individuals. Okay. So I might be affected, you might be affected, but the degree is different because we are two different individuals. Okay. And this is what is known as variable expressivity. All right. For example, manifestation of neurofibromatosis type 1 range from brownish spots on skin to multiple skin tumors and skeletal deformities. So you might have somebody that has this neurofibromatosis type 1 is having brown spot. Another person will be having multiple skin tumors. Another person will be having skeletal deformities, all right? So it alters. Now, the mechanism underlying incomplete penetrance and variable expressivity are not fully understood yet, but most likely is resulting from the effect of what other genes or environmental factors that modify. Okay, so you might be living in a different place that the place is actually favoring this. Okay, there's a study still ongoing for this. For example, phenotype of a patient with sickle cell resulting from mutations at the beta globin locus is influenced by the genotype of the alpha globin locus because the latter influences the total number of hemoglobin made. Okay? Biochemical mechanism of autosomal dominant disorders are best considered in the context of the nature of the mutation and type of protein affected. Most mutation lead to what? Reduced production of a gene product, or they could give rise to an inactive protein. Okay, so now this is actually the effect of loss of function mutation, depending on the nature of the protein affected. We'll actually still look at the gain of function as we go on. Now, if the mutation affects an enzyme protein, the heterozygotes are usually normal because up to 50% loss of enzyme activity can be compensated for. All right, mutation in genes that encode for enzymes do not manifest an autosomal dominant pattern of inheritance. Okay, now by contrast, two major categories of non-enzyme proteins are affected in autosomal dominant disorders. We have those that are involved in the regulation of the complex metabolic pathways that are subjected to feedback inhibition. For example, membrane receptors such as low density lipoprotein receptor provide one such example. In the familial hypercholesterolemia, a 50% loss of this low density lipoprotein receptors can result in secondary elevation of what? Cholesterol. Okay, in turn, this will predispose the person to developing atherosclerosis where there's what? Narrowing of blood vessels. Also, another type of enzymes that non-enzyme proteins that could be affected, we say that key structural proteins such as collagen and cytoskeletal elements of the red cell membrane, for example, spectrin. The biochemical mechanisms by which a 50% reduction in the amount of such proteins result in an abnormal phenotype are not fully understood yet. Then, that was loss of function, right? There's another word, gain of function, but these ones are less common than the loss of function. So that this will tell you that most mutations are negative, will have a negative effect on you, right? But there could be some mutations that will help you live better, all right? But these are less common. Now, as the name indicates, this type of mutation, the protein product of the mutant allele acquires new properties not normally associated with a wild type protein. Okay. Now, the transmission of the disorder produced by the gain of function mutation is almost always autosomal dominant, as illustrated by what? Huntington's disease. Now, in this disease, the trinucleotide repeat mutation affects the Huntington gene, giving rise to an abnormal protein called Huntington. Now, this is toxic to neurons. Now, hence, even heterozygotes would develop a neurological deficit. So, the gain of function is not really saying that the protein is gaining, all right, a better function. This is just like there's an introduction of a new function, all right. So, this new function could be bad too, all right. So, guys, that's it about understanding the concept of what autosomal dominant disorders, guys.